For one reason or another, you've come across hyperbaric oxygen therapy and you're still wondering, is this right for me? Is this a good fit? Is it safe? Is it appropriate? How does this thing work? Today, we're going to go deeper into Hyperbaric 101. How does hyperbaric oxygen actually work? And what are some of the benefits that somebody might expect as a result of going through a hyperbaric oxygen protocol? If you're new to our channel, I'm Dr. Jason Saunders. I've been running a hyperbaric clinic for over 20 years, and I've taught and I've certified clinicians and technicians in hyperbaric medicine all over the world. And in today's video, I'm going to share how hyperbaric oxygen works and what benefits people can expect after going through a hyperbaric protocol so that you could better understand if hyperbaric is appropriate for you or a loved one, and therefore move confidently into a hyperbaric program if that's right for you. Let me start this video with some, not all, but some of the benefits of hyperbaric oxygen. Hyperbaric oxygen helps to increase ATP or cellular energy production. It's going to reduce oxidative stress, which oxidative stress has been blamed for most of the chronic illnesses that people are suffering from. It's going to help us build new blood vessels. It's going to reduce swelling and edema. It improves mitochondrial function, mitochondrial size, and even mitochondrial density. It helps us to decrease inflammation systemically. Obviously, it improves oxygen perfusion to all of our cells and our tissues. It can help kill anaerobic bacteria, which are the main bacteria causing so many of the chronic infections that people are suffering from. It increases our antioxidant levels inside of our body. It can shift our epigenetic expression and improve DNA repair inside of our cells. It helps us to regulate and balance our immune system, and it helps us to release stem cells and other growth factors for tissue repair and for tissue regeneration. It's incredible that this singular therapy is capable of having such a wide range of impact on our bodies biologically. It's almost too good to be true. How could this one therapy treat and cure so many different diseases and illnesses? Well, let's stop there. Hyperbaric oxygen is not a cure nor a treatment for most of the things that we use hyperbaric oxygen for. In fact, it's your own body that's capable of healing and regenerating. Hyperbaric is simply a tool that's delivering an enormously large amount of oxygen, the amount of oxygen necessary to create these significant changes inside your body at a cellular level. And in fact, hyperbaric oxygen therapy is the only tool that has the capacity to drive this amount of oxygen into your system and cause this large of a change in your body cellularly. It still surprises me every day that while hyperbaric is so unique and so powerful that many people are just first learning about hyperbaric today. And I believe a lot of that is because there are still so many myths and misconceptions around hyperbaric oxygen. Even inside of medicine, most practitioners don't truly understand what hyperbaric oxygen is, what hyperbaric oxygen does, and what it's capable of. Those myths and misconceptions have led to many misunderstandings around the safety and efficacy of hyperbaric oxygen, and therefore hyperbaric continues to be underutilized all over the world. My goal today is to share enough information with you so that you better understand the science behind hyperbarics so that you can best gauge whether or not hyperbaric is a good fit for you. First, you need to understand that oxygen is a critical molecule in your body necessary to help you perform almost every cellular function that you can think of. In fact, oxygen is one of the rate-limiting steps to how your cells make energy. And if your cells can't make energy, they can't do their job. And if those cells aren't doing their job, we see sickness and disease as a result. Almost every chronic illness that you can think of has hypoxia or low oxygen levels as a hallmark of that disease. And as we drive oxygen levels up in our cells and our tissues, we reduce the likelihood and the capacity for those diseases to even exist in our body. I also want you to understand that right now, as you watch this video, if your lungs are healthy, if your heart is healthy, if your blood vessels are moderately healthy, the pressure of our atmosphere and the amount of oxygen we're breathing is causing us to carry as much oxygen as possible in this moment. If you've ever had a pulse oximeter on your finger at the doctor's office or, God forbid, in a hospital, you know that with a healthy lung and a healthy heart, breathing air, which is 21% oxygen, at 1 atmosphere of pressure, which is sea level, you should be about 98, 99% saturated, meaning your red blood cells are already carrying as much oxygen as possible. And therefore, in traditional medicine, we view that as there's no need for oxygen treatment because you're already fully saturated. This is where the distinction for hyperbaric oxygen begins. Oxygen is a passive diffuser in our body. What does that mean? It means that Oxygen relies on a natural pressure gradient to get oxygen from the atmosphere that we're living in into our lungs and into our circulation. In other words, the pressure of oxygen in the atmosphere, in the air that you're breathing, has to be higher than the pressure of oxygen in your lungs. And if it is, we can pull that air and oxygen into our lungs as we inhale. Now, with a lung full of air, the pressure of oxygen in our lungs needs to be higher than the pressure of oxygen in our circulation. And as long as that's true, oxygen will diffuse from our lungs into our circulation. This is all done passively through pressure gradients. The rate or the power of the diffusion has everything to do with the magnitude of size difference in those gradients. In other words, if I had 99 molecules of oxygen in this hand, and I had only one molecule of oxygen in this hand, there would be a pressure gradient of the oxygen on this side wanting to move down its pressure gradient. And oxygen or anything that's diffusing passively moves down its concentration gradient from high concentration to low concentration and will continue that movement until it reaches equilibrium or saturation. When it comes to the oxygen diffusion from the air that you're breathing down into your cells, we're increasing the pressure and we're increasing the gradient of oxygen. We're driving that oxygen into your circulation, but we're never going to reach a point of equilibrium or saturation because your cells are using oxygen almost as quickly as we can drive it in. And so as we increase these pressures and drive more oxygen in, we're driving more oxygen into the cell, which is creating that cellular energy we were talking about earlier. And for almost as much as we can raise the pressure gradient and the amount of oxygen into the cell is as quickly as we can create more and more cellular energy. When it comes to the diffusion of oxygen, I usually start with the opposite of hyperbaric, which is hypobaric. In other words, less pressure. So we have all had the experience where, let's say if you live at sea level and you go skiing in the mountains, or you live at sea level and you're going to visit somebody, let's say in Colorado, or even locally, you just pick a mountain near you and you go for a hike. As you leave the Earth's surface and go up in elevation, most of us have had the experience that it's harder to breathe. And we say, oh, well, there's less oxygen at elevation. Just to be clear here, it's not a percentage difference. In other words, air is 21% oxygen at sea level, and air is 21% oxygen at the top of Mount Everest. There is no difference in percentage of oxygen at either of those locations. However, you can breathe easily and comfortably at sea level, and you couldn't breathe at the top of Mount Everest without an oxygen tank. What is the actual difference? It's in pressure. What happens as we go up in elevation? Well, we lose pressure. And as we lose pressure, the molecules of oxygen spread out further and further. So, in other words, and these are not actual numbers, but if I took a full lung volume of air at sea level, let's just say that I can bring in 20% of that air as oxygen molecules. So if I brought in 100 units of air, I can bring in 20 molecules of oxygen. Well, at the top of Mount Everest, because all of those air molecules are further and further apart, I might still take a full lung volume of air in, but now only 4 molecules of oxygen instead of 20. And do you see how that quantity is actually the gradient? It's the concentration of oxygen. As we lose the concentration of oxygen at elevation, we lose the gradient power, the driving force of getting that oxygen from our lungs into our circulation. Well, the opposite is true as we go below sea level. As we go below sea level, pressures increase. And as pressures increase, air molecules, oxygen molecules start moving closer and closer. So now if I took that same full lung volume, 100 units of air into my lungs, instead of 20 units, I can get 30 or 50 or 40 or 400. In other words, at pressures greater than sea level, I can increase my oxygen concentration 30%, 50%, 100%, 200%. And there are 2 factors at play here. The first is the total pressure that someone's being exposed to. In other words, if I went from 1 atmosphere to 2 atmospheres, I doubled the pressure, but I was still breathing air, 21% oxygen, I would double the amount of oxygen in my blood. However, if I was breathing 100% oxygen at 2 atmospheres, well, now it's not a doubling effect. Now it's 14 times, 16 times, 20 times the amount of oxygen based on total pressure and percentage of oxygen. So the percentage of oxygen you're breathing at pressure is a magnifying effect on the total dosage of oxygen that somebody receives inside the hyperbaric chamber. As I was saying earlier, right now I'm at sea level. So at sea level pressure, which we call 1 atmosphere, breathing 21% oxygen, and I have healthy lungs and I have a healthy heart, if I put a pulse oximeter on my finger, I should see that I'm saturating my red blood cells close to 100% saturation. But that's the most I could possibly carry. Virtually all of the oxygen that I'm bringing into my body right now, once it's in circulation, it's picked up by a red blood cell and then delivered to the cells and tissues that need the oxygen for doing their job. Very little of the oxygen I bring in right now is just free floating in the plasma of the blood. 99% or more of it is bound to a red blood cell. Let me just summarize where we are right now. No matter where you are on planet Earth, you are surrounded by an atmosphere, and that atmosphere has a pressure. The pressure of your atmosphere is what allows you to extract oxygen from the environment that you're breathing. At 1 atmosphere, you should be able to fully saturate your red blood cells. If you live at elevation, you probably don't saturate your red blood cells fully, and there's an adaptation that our body goes through as a result. So if you live in Colorado and I live in Florida, you would have more red blood cells than I do. Why? Because as your body senses lower pressure chronically over time, the body creates more red blood cells to carry the necessary amount of oxygen to all of our cells and tissues. But no matter what, you still have an atmospheric pressure around you, helping you drive that oxygen into circulation. As you go up in elevation and lose pressure, you lose that driving force. And as you go below sea level and increase that pressure, you're increasing the driving force. The most important thing that you can understand from this conversation is that our red blood cell saturation levels are a very myopic view of total oxygen carrying capacity when we start to change atmospheric pressure. Hyperbaric is governed by about 7 gas laws. We're going to cover the 2 most important for you to understand. The first one is Boyle's law. We already spoke about this a little bit, but as I increase the pressure of a gas, I can condense that gas into a smaller space. And then Henry's law. And Henry's law says that as I pressurize that gas and hold it over a liquid, I can now drive more of that gas into the liquid that I'm holding it over. The easiest example for this would be a bottle of water versus a bottle of seltzer. If you couldn't touch them, you couldn't shake them, and you couldn't open them, and I hid the labels, you might not know the difference on a shelf which one was carbonated water and which one was just regular water. What would you need to do? You would need to open it. And when you open both, one of them doesn't change at all, and the other one starts releasing this gas. Why? Because what did you do in that situation? You pressurized a gas, carbon dioxide, you held it over a liquid, water, and then you drove excess gas into that water and put a cap on it. And as long as the cap stayed on it, all of that gas was in solution. What are we doing in hyperbaric? We're pressurizing a gas, in this case, oxygen. We're holding it over a liquid. In your body, that liquid is your plasma, the liquid portion of your blood. But eventually, that's also your lymphatic fluid. It's your interstitial fluid. It's even your cerebral spinal fluid. All of your fluids will become saturated with oxygen as you're exposed to this increased level of pressure and this increased percentage of oxygen. And as long as you're inside that chamber, all of that excess oxygen stays inside your circulation, continues to circulate, and nourish your cells and tissues with additional oxygen that without that pressure would have been impossible. What's the impact of the increased amount of oxygen that's now circulating through your system? There are 3 specific effects that I want to share with you. The first is that this oxygen is not bound to red blood cells. It's free floating. And as a result, it doesn't have to follow any of the rules that oxygen bound to red blood cells have to follow. And so as a result, this oxygen is free to move through your circulation and, simply said, diffuse into every nook and cranny. All the different cells and tissues that your circulatory system pass through have access to this free floating oxygen. The next is that red blood cells, which are carrying your oxygen right now, might not be able to reach all the cells and tissues it needs to. What if you had capillary damage? What if you had capillary blockage? Some examples, atherosclerosis or ischemic tissue or an ischemic stroke as an example. Well, red blood cells can't reach those tissues and cells because there's a blockage in the capillaries not allowing red blood cells to reach those cells and tissues and deliver the necessary oxygen to keep those cells and tissues alive. However, because you're now dissolving oxygen into the plasma of the blood, there's nothing that stops the fluid from moving through those areas. And so now all of a sudden, even just in the first few minutes of hyperbaric, you're now delivering oxygen to potentially hypoxic cells and tissues because it could bypass any of that capillary damage or capillary blockage. And the third effect brings us back to that conversation about the bottle of seltzer or carbonated water versus the bottle of water. As long as the cap was on that bottle, that gas stayed inside. But when you took the cap off, that gas comes rushing out. Similarly, when you're in a chamber, that gas, the oxygen, stays in your circulation. When you get out of that chamber, the oxygen is trying to get out of your system. As a result, there's an amazing impact that the oxygen actually can travel much further away from a capillary and still be metabolized by a nearby cell or tissue. In other words, there's a certain distance that oxygen can typically travel from a capillary to nourish the surrounding cells. But because this oxygen is now pressurized, picture how violently some of that carbon dioxide comes out when you open a bottle of seltzer. It's much more forceful. Well, when you get out of the chamber, oxygen is coming out of your circulation much more forcefully. That's not dangerous. In fact, it's one of the major benefits of hyperbaric. Because of that distance it can travel, it can now nourish a much larger surrounding area. Think about, again, areas of tissue damage, tissue necrosis, like cells and tissues that are dying, or again, back to that post-stroke analogy, where oxygen's not making it to these cells and tissues, and it's becoming hypoxic and potentially necrotic or dying. All of a sudden, we can nourish those cells and tissues with oxygen because of how far the oxygen can travel now that it's been pressurized. And in fact, that distance can be up to 4 times further after a hyperbaric session than under normal atmospheric conditions. So when you start to recognize all the different roles that oxygen plays inside of our body, and then you understand that under normal atmospheric conditions and under normal oxygenation conditions, we are limited by our red blood cell count with how much oxygen we can carry. And then you recognize that for a variety of reasons, chronic inflammation, chronic toxicity, tissue damage, whether that's an injury or even post-surgical damage, that there's a range of issues that might cause minor or even mild to moderate amounts of hypoxia. Yet, in this normal atmospheric condition, there's no mechanism that we have to increase our oxygen and create normal levels of oxygen, normoxia, inside these hypoxic cells and tissues. The only way we'd be able to do that is by changing atmospheric pressure. And inside of a hyperbaric chamber, that's exactly what we're doing. We're temporarily increasing atmospheric pressure. We're temporarily increasing the percentage of oxygen that you're breathing, often. And between those two factors, we are massively magnifying the amount of free-floating oxygen inside your cells and tissues. Sure, we can saturate your red blood cells 100%, but what we're doing is we're bypassing your red blood cell carrying capacity as the limiting factor for how much oxygen you can carry. We'll saturate those red blood cells, but then we will super saturate the plasma. And that's the key to hyperbarics. It's that super saturation of plasma that's creating this massive increase in quantity that leads to the benefits that we talked about earlier in the video. And hopefully now you understand why hyperbaric is actually so incredibly powerful and so incredibly unique in being able to do what hyperbaric can do. In our next video, we're going to go back into those benefits and actually the mechanisms behind those benefits so that you'll be better able to understand we increased the oxygen, we shifted the body's physiology. People see these benefits of going into a hyperbaric chamber, and next we're going to connect the dots between how did that increased level of oxygen actually start to shift and help that patient experience those variety of benefits. So, as always, thanks again for your time and attention, and I'll see you on the next video.